Hi, this is Dr. Karana Fairley with Greater Southwest Medical Associates. It's back to school time, and that means it's time for your child's school physical. Here are a few things you should know. It's important for students to have school physicals because we need to know in the school setting if there's a medical condition that warrants extra attention during the school day, and also to be sure that a child is free of any infection or other condition that would put themselves or others at risk. Most importantly, if kids are current on their World Child exams, they may not need a separate physical at the time of the school year beginning, unless they participate in sports where a separate examination is necessary. Physicians need information pertaining to the child's medical history. It's not only their individual history, whether they've had hospitalizations, surgeries, but also the family history. It's particularly important when we're examining them for sports participation. But overall, that information plays into things we might pay extra attention to if they're at higher risk for. And also a list of medications, including supplements and vitamins. The physical examination for school physicals involves a general exam from head to toe. Of course, it begins with the vital signs taken by our assistants and nurses, including their blood pressure, their heart rate, respiratory rate, and then we also are looking at their height and weight. After that, head to toe, looking at the ears, eyes, checking their throat, their neck, lymph nodes to make sure there's no any swelling in those areas, their lungs, heart, abdomen, a general exam of the musculoskeletal system to make sure the joints are all moving and getting the appropriate ranges, and also a neurological exam. If a screening detects an area of concern, there may be additional testing in the office that day, depending on what the finding is, and otherwise it may require a referral to a specialist or to an outside center for additional testing. Advice I would offer to parents coming in for school physicals is to come prepared with the list of immunizations and any records that you have on their past medical history. If it's not particular records themselves, just a list of those important events. And also a list of questions that you have, any concerns about their growth or things you should expect for that coming school year, or advice you'd like to have in helping them be successful in that next school year.